Hello and welcome to yet another very interesting where we enlighten and educate you on health issues bothering you, just to ensure that you keep staying healthy and fit. My name is Umo Basi Edate, and today I have here in the studio Dr. Andrew Ian, a senior registrar with the Department of Ophthalmology, UUTH, an important part of your body. And we'll be looking at eye, but specifically we are looking at glaucoma this week. Doctor, what is glaucoma?
Well, I would define glaucoma as a group of diseases that causes a progressive neurodegenerative disorder of the retina, what we call the retinal ganglion cells that you see to the brain for it to be interpreted for us to see. So what glaucoma does is that slowly and steadily it destroys this optic nerve. Understand? Thereby, once it is totally destroyed, it causes blindness. Glaucoma, we refer it to the silent thief of sight, because what it does is that it might not come with any symptom. The patient might not even know that he or she is not seeing, because the pattern of destruction and the pattern of vision loss, it comes from the sights. So the person might be seeing very well straight ahead, but the sights, the vision is narrowing until the patient has a tunnel vision. That's why sometimes it should be tested for most drivers, because most of them their peripheral vision might be gone, so that they are not able to see from the sides, so they can easily bash into things without knowing. So glaucoma offers a big burden of the disease. Understand? As at 2010, about 68 million people were diagnosed to have had glaucoma. This was further increasing to about 78 million as at 2020, and it's projected that by 2040 about 111 people will be suffering from this glaucoma. So you see the impact that this can have on the economy, because if someone is blind from glaucoma and the person was a breadwinner of the family, so this will impact on the socio-economic standing of that family, even on the psychology of this particular person, because the person can be depressed, because you are seeing before and you're not seeing. So when we are taking care of people that have glaucoma, a lot goes into it. A lot of counseling, occupational therapy, and everything, and also counseling of a lot has to change even inside the house, because you have to rearrange the way the house is being set up. Understand? So that's just a brief overview about glaucoma.
It's so scary to say that it doesn't come with symptoms most times. So how do you know if somebody has issues with the eyes? How do you know that this is glaucoma? Because somebody may just think it's normal. You understand? What are those things to look out for to make someone go to the hospital and maybe carry out some tests? How could it be detected?
All right. A lot of the diagnosis that we make at the hospital is usually how do I say it, accidental finding. Understand? Because the patient will come complaining of something else, and in your routine examination, and then in your routine examination, you now notice the signs of glaucoma, because most of the time the glaucoma causes painless, slowly progressive diminution of vision. That means your vision will be deteriorating and you will not know. Gradually, it's painless, doesn't have symptoms. But there is also another type of glaucoma that we call the angle closure glaucoma that can come with symptoms, and this makes up about 10 to 15% of people that have glaucoma. So this one can cause pain, redness, blurry of vision, tearing, and all that. But majority of people don't have symptoms, and they are living with glaucoma without knowing that they are living with glaucoma. So we encourage routine eye checks for people. We encourage people, even though you think that you are actually seeing very well, just go to the hospital for routine eye check at least once every year for it to be checked. So that way we can actually detect it.
Honestly, I was about asking how often should one go for eye test, because I don't think we do it. I don't
No,
think we do it.
because when people are under insurance, you know that you are not paying out of your
Pocket.
pocket. You can easily go into the hospital and have your eyes checked.
It's true. I agree with you totally, Dr. Andrew, because some people, even when you're trying to propose these routine medical checks, people will just tell you that, look, the moment you go to the hospital, the doctor will always diagnose something. They will find that, oh, there's something wrong with you. One thing or the other must be wrong with you. So it's better you don't just go and buy market. Okay, and so talking about glaucoma, what are the people at risk now?
Now, there are various risk factors for glaucoma. Age, in which people greater than 40 years are more at risk. More at risk. Raised intraocular pressure.
Meaning?
Just like you have your blood pressure.
Oh.
Yes, that's what we call the intraocular pressure, the pressure inside the eyes. And then also there's also the family risk factor, that's genetics. Now, so if there is someone in the family already that has glaucoma, the risk of another member of the family having glaucoma is also increased. But the highest risk factor in all of this is the intraocular pressure. That is the pressure inside that, and it is the only modifiable risk factor, because you can reduce the intraocular pressure, while those other ones are non-modifiable, because you cannot change your age.
It's true.
You cannot change the family.
You can falsify the age.
You can always falsify the age. Your age will always remain. Yes.
Okay, so how can you reduce this pressure? Is it by drugs, medications?
Yes, there are various modalities in reducing this pressure. You can either use the medical routes, using medicines, or use the surgical approach. So once we see a patient, we tailor everything that we are doing for the patient. So each form of management that we are doing is individualized. I see a particular patient today and I see another patient tomorrow. I will not treat them the same way, because I will take into cognizance their age, the level of damage that this glaucoma has caused, the time that they are presenting, and then the level of the eye pressure that we have. Understand? For example, someone that is young, let's say someone that is 30 years old and is coming with the glaucomatous damage. Yes, although I will discuss all the options available with the patient, but I'll most likely want to go for a surgical approach, because this patient, because treatment for glaucoma is lifelong. Understand? So I like using the word management, because you manage it. It's a lifelong management. So someone that is 30 years old, who has the ability to he might live for up to 80 years. So imagine someone using eye drop every day for 50 years. That's not tenable. So if surgical approach is now employed, now you take this person off the eye drop, or the number of eye drops that this person might use in reducing the pressure. So once you reduce the pressure is reduced, so that the pressure on this nerve is now reduced up to a level that the damage will stop from progressing.
Thank you so very much, Doctor. Let's also, we're talking about children. You talked about age, the age range. So does it affect children? Can children go down with glaucoma?
Yes, of course, because that's where the role of genetics comes into play. I've seen babies being born with glaucoma, and those ones, they are telltale signs that you see in the eyes, and you know that this is likely glaucoma. Although of recent, I've seen very young children, less than 10 years, between 10 and 20, coming down with almost end-stage glaucoma. The vision is almost gone. So, but there's what we call the congenital glaucoma, in which you now see these signs. You see the black part of the eye, called the cornea. You see the size. So in these children, it's very shiny. The black part, it reflects. In these children, this black part will be enlarged, you see it will be bigger than what it's supposed to be, and it will be hazy, it will be cloudy,
dusty,
and this child will be tears will coming out from there. So that already tells you that there must be an elevated eye pressure since the baby was inside the womb. In utero, understand? So that will also, it gives you an idea this might be. So you go ahead, check the pressure and other tests that we do. So for those kind of congenital glaucoma, the treatment option is usually surgery, in which for the child you reduce the pressure, and all these signs that say might reduce, might actually them tell down, regress. Yes, so children can be affected. Yes.
Okay, well, you read it all, and still talking about those things that can indicate that somebody has glaucoma. We have people born with squint eyes. Is that what they call it?
Yes.
Their eyes are squint.
Yes, we call it strabismus. Yes.
Okay, so is it eye disease?
Well, for strabismus, it's usually because the two eyes are supposed to see equally. That's so. Okay,
some people may not understand what we are actually talking. Maybe you would have to explain when we talk about squint eyes now.
Okay.
That they used to call it 4:30. Some people call it 4:30.
Yeah. Okay. You know the two eyes are supposed to see straight ahead. Understand? So for some people, one eye can be straight ahead.
If you're just joining us, the program is Health Matters, and today we are discussing glaucoma. We have our guest here, Dr. Andrew Ian, who is a senior registrar, Department of Ophthalmology, UUTHUU, and he's been doing a lot of justice to this topic, glaucoma. What do you need to know about glaucoma? Some people gradually lose their sight without symptoms. They don't even see anything coming, and boom, the next thing, their sight is gone. So if you just stay tuned, you know about glaucoma and know what next to do about that eye issues that you have. So stay on.
Shown that once for the stress that the eyes or undergo, so this nitrate helps in mopping up and also ensuring that this processes go on smoothly. So your diet is actually good, just like any other thing. That's this vegetable, your antioxidants, because the eye is working every time there's all those metabolic processes. So there are reactive oxygen species that that goes on in the eye. So your antioxidants are also very good. Your vitamin A, C, and E, they help in mopping up all these eye reactive oxygen species that may cause damage to the eye. So your diet and how you take care of yourself, exercise, maintaining a healthy weight, everything interplays, healthy living in insurance, so the eye is not left behind in this.
Okay, we also hear, I don't know if it's a myth, when people talk about eating too much gari, that it could affect the eye. Is it true?
Well,
especially hot gari.
Well, let's say this. You know, the unprocessed cassava has a lot of cyanide content, which is poisonous, and it's even much more poisonous to the eye. So with your gari that has undergone process that you've peeled it, you fried it, and everything. So, and even with the hot water that you are using, it's still a form of processing the gari. So a lot of this cyanide content has been removed or reduced. So I think that goes on with them eating raw cassava. You understand, or unprocessed cassava or poorly processed that might still have this low content. But in all, a well prepared gari is it's okay. It doesn't cause any eye problem per se.
Okay, so still talking glaucoma, how can glaucoma be managed?
Okay, glaucoma, there are various modalities in managing glaucoma. It all depends on the age of the patient, like I said, management is individualized and is lifelong. So it depends on the age, the level of damage that has already taken place before the person arrived, and the level of eye pressure. What is my target for this patient? For this patient, so we have the medical management that has to do with giving of topical medications. That is your eye drops, and we also have surgical management, in which it involves the creation of an artificial pathway for this fluid inside the eyes to be drained to reduce the pressure. So those are the two modalities of management, and suffice it to say that management of glaucoma, because glaucoma causes irreversible loss of vision, so management is not aimed at restoring vision. It's aimed at stalling the progression, stalling the blindness, and preventing further damage and preserving the vision from further deteriorating. So that's the aim of the management. So it could be medical, it could be surgical.
Okay. About what of people that may decide to go the herbal way?
Well, well, like I said, any installation of any traditional or herbal concoction today, that is a very delicate structure. So at the end of the day, if there is no scientific proof that this herbal medication that you are putting, because we as doctors, we are scientists, we deal with facts, we don't deal on beliefs and faith and all those things. So what I do for the patient is based on science. There is research that has been proven that this method works. And for traditional or herbal preparations, I am not aware of that. And most of these things are very toxic and harmful to the eyes. It might even melt the eye. So I'll always tell people, please don't instill anything that is not being prescribed by an eye doctor in your eyes, because you might you might just be making your vision to go faster than it's supposed to go.
You've heard it. Glaucoma causes irreversible loss of vision, so you just have to be careful. Don't tamper with your eyes. If you have issues, if you have any challenges with your eyes, the first thing you should do is go to the hospital and report to the doctor. So Dr. Andrew, let's look at the innovations and future of treatment as regards glaucoma. Okay,
concerning the innovations, because over so many years is based on eye drops, and most of these eye drops, they contain preservative that maybe for prolonged use it starts becoming toxic to the eye, causing redness, changing the color of the skin, the length of the eyelashes. So there are innovations now that uses newer preservatives to make it much more comfortable for the patients. And there's also some eye drops that are gel forming, such that once you instill it into the eyes, it forms gels that can stay in the eye for up to a month. So you can just need one eye drop. Now there are also ocular rings that you just insert it into the eye, so that it releases these drugs slowly and on its own inside. That's why you don't need to carry so many drugs around. And you also have combination drugs that's like two or three drugs are combined into one bottle, so that you have only one bottle that you are that you are carrying around. And there's also the advent of most of this medication being infused into contact lenses, so that you just wear your contact lenses as you are going around. The drug is now being still dissipated into the eyes, and it's still doing its work. So there are so many innovations, and there's also ongoing research into gene therapy, in which they can have the retinal ganglion cell transplantation in future. It's currently being researched, and if this is done, there's a possibility of actually reversing this damage that has been done. So the scientific world, the medical world, is actively researching into how this can be reversed, because it places a greater burden on people, not just on the patient but on the family and society at large.
Okay, when you talked about contact lenses, it took me to the issue of fashion, the fashion world and the eye. You see a lot of women carrying eyelashes, some very long, and because of putting these eyelashes, they introduce glue into their eyes. So what's your take on this?
Well, as an eye healthcare personnel,
Yeah.
it is actually a very harmful eye
That's
practice on understand. Glue entering the eye is also the risk that goes with whatever fashion that you are going to that you are practicing. Also, I see a lot of people with non prescribed contact lenses.
Yeah.
You could introduce bacterial infection into the eyes, and with prolonged contact lens wear, the eye can actually be eroded, causing an ulcer in the eye.
Really?
Yes, because most people, the contact lens comes with a fluid that you are supposed to rinse it, understand?
Yeah.
So most people, because of the contact, they are using it for fashion, they don't have anybody teaching them on these processes. Most of them can use tap water to store it. I've seen a lot. Once you put it into the eye, the cornea, it can peel. So it's actually a very dangerous practice. So I usually discourage people from that.
Okay, but before I let you go, Dr. Andrew Yang, or Senior Registrar, Department of Ophthalmology, UUTH, let's just take a recap. What are those things that you think people should do and people should not do as regards the eye?
Well, as regards the eyes, proper taking proper care of the eyes, washing your hands, don't introduce any herbal medication, not using contact lenses that are not prescribed, and also any eye problem that you have to go to see the eye doctor, not going to the chemist, the pharmacist, because at the end of the day, the cost of complication might even be more than the cost of going to the hospital. And for glaucoma specifically, I want to drum it that early detection is key. Early detection is key in stopping or preventing blindness that is being caused by glaucoma, because it causes an irreversible blindness. So our aim is to stop the damage from occurring in the first place. All right, thank you.
Thank you so much, Dr. Andrew Yang. And that does it on Health Matters this week. We've been speaking with Dr. Andrew Yang, Senior Registrar, Department of Ophthalmology, UUTH, and the topic was glaucoma. You've heard it all. Glaucoma causes irreversible loss of vision, so it's not something you have to joke about. There are so many things that contribute to it: your lifestyle, nutrition, genetics, age. So you don't have knowledge of this thing. It is your duty. The only thing you have to do is just take your walk to the hospital, get to see an ophthalmologist, and find out what exactly is wrong with your eyes before you begin to introduce eye drops or whatever into your eyes. Thanks for watching. Let's do it same time next week. Bye.